Welcome back, everybody. This is in regards to myself. I'm your host, Jesus. Joining me today on the podcast is none other than the Dr. Christian Romero of Chiropractic. What's up, bro?
What's going on, man?
Thank you for blessing me with your presence on the show, man.
Appreciate you having me here.
So,
Absolutely.
how you been, bro?
Been doing well, man. Just keeping my head focused and leveled, and I'm glad you invited me here, man. It's been almost 4 years since I was in school, and just got out, and I have more fire and energy to keep working and keep helping as many people as I can.
How have you been holding up throughout this quarantine and stuff? Especially since we probably even to go back to closing back everything again.
It's been an obstacle, everyone's going through it. So what I did was kind of take a step back, reflect. Obviously I was going to start my career as soon as I graduated, but I think things happen like this for a reason, and so I'm taking it in, letting God's plan unfold, and just seeing it from a more optimistic way, and just figuring out things that I knew in myself that were weaknesses to just kind of build upon and strengthen what I already have.
Hell yeah, dude. That's important, right? Like understanding how we can, being able to be open-minded, being able to change our minds, right? Being presented with new kinds of facts or new studies or whatever, and that's how you grow, right? Just being able to, instead of shutting people out and judging them, I don't believe what you believe. Mm-hmm. It's like, no, okay, yeah, I'll listen to you.
Just inviting them to the conversation, just
something pretty cool about you, bro, is that you come from a very talented family. Your brother, he has his own business. Yeah. But this is your business right here.
Yes, sir.
So, for me, I like chiropractics. I've done a little bit of research, right? But in essence, to you, what does chiropractics mean?
So chiropractic.
Oh, I'm sorry.
Chiropractic, yeah. So chiropractic, to me, is from a personal level, it's changed my life. Okay. I'm a chiropractor today because another chiropractor influenced me, and then obviously I got into seeing more what it was about, and then it eventually became part of me. But as far as chiropractic in essence in this world, it's fairly new, actually. We just started up D.D. Palmer first chiropractic adjustment in 1895. Okay. So fairly new,
within the last 100 years.
Yeah, and it's crazy to me because the amount of people that it's helped, and it has saved, and not just me, just being a patient. Also becoming a chiropractor, it has influenced so many minds, and not just here in the Western world, also in the Eastern world. But it's continuing to legitimize, obviously with social media and having that big social media presence as well. People are starting to really open their eyes and see kind of the real paradigm, the true paradigm of what it is, what healthcare should be about, and chiropractic is one of those answers, one of those treatments that we can really give to people all over the world, and it's starting to get bigger, but it's obviously, with all the love and all the great results, there's obviously hate. There's people scrutinizing, and there's political parties forming against it, and it's all a game. But I'm doing my best, the best I can, and just myself, to get as many people better as possible, and see as many spines as I possibly can, and not just here in California, but eventually I was seeing people in Mexico too, and in India as well, and those were very humbling experiences, and I'm really glad I'm in the profession I am today.
And that's the thing, right? Some studies have shown that chiropractic helps. Especially, you have a lot of studies that have shown a lot of positive results as far as lower back pain, lower chronic back pain. And you touched on it yourself, right? You said that some people are there, trying to discredit it, right? Yeah. But one thing I appreciate about you is, even when I've asked you, well, what about this or what about that, you're willing to hear me out. Yeah. And you're not shutting me out like, no, dude, it has to be this way, right? Yeah. But personally, so when I first started going, I was just like, you know what, man, fuck it, I'll just try this shit. Why not? I had heard good things. I heard it was gonna supposedly save your back, and my kind of job, I was like, oh well, why not? Let's do it.
Exactly.
but even then, right? Like a lot of people say, "Oh, it's a placebo effect," but even if that was the case, like for me, it works.
Yeah.
And I've seen for a lot of people, it works as well. It's not one of those things where, oh, like we talked about, it's not a one size fits all, right?
Exactly.
But for me personally, especially because you and I wrestled, and you and I had, well, you had you had a back injury, a shoulder injury, and a neck injury.
Yeah.
From wrestling, I got a shoulder injury for sure. But even when I'm wrestling, like now, every now and then I'll tweak my neck, and I know that if I go get adjusted, that little kink goes away.
Yep.
It's not like it goes away instantaneously, but it'll take a couple hours, and then I'll feel way better.
Yeah.
And that's like, that's to me, that's the beauty of it, right?
Exactly.
But based off on the schooling that you've done, which you said you went to Life College West of Chiropractic.
Life Chiropractic College West.
Life Chiropractic of College West, right? And that's how long is that program?
It's a 3.5-year program.
Okay.
Depending, there's 2 tracks. There's 3 years and 3.5. I took the 3.5.
Okay, and what does that include?
So there's basic sciences. There's diagnosing, pathology. There's pretty much everything you have to learn as a medical student, but just without the pharmacology side.
Okay.
So we learn more or less the whole spine, the anatomy of the spine, the mechanics of it, the ins and outs of it. So we try to put our focus on that, and also chiropractic and how to, it's an art within itself. So it's like we have to constantly every day practice it. And when I first started chiropractic school, I really sucked. I was practicing on people, and I didn't. It was, even though some people, they say, it looks easy to do, because the way I do it makes, the way you see other chiropractors do it, it looks easy. But there's so much beforehand that you need to kind of have to build up, like within your chiropractic lens.
Okay.
From seeing the misalignment, from just having that patient walk into your door and already noticing like there's a postural interference already going on.
Okay.
There's already postural distortion. I can already see it. What can I do to help this person get back into normal posture? What is this person? What kind of complaints are they showing up with? So you put all that into, compile it all together, and then you say, okay, what is where is the misalignment? Where is the true misalignment? What is causing all this? And so as you figure out the patient, because every patient is like a puzzle pretty much. You can have one complaint. It could be the same complaint, but the person has totally different misalignments, totally different things going on with them. So it's been tough going through that in school, and lack of experience, just noticing, just going through the school lecture hall, and then finally getting into clinic, and then seeing real life patients, and you start to build up that sensitivity, like your fingers, even when you palpate people's backs, you already have that connection.
You're able to tell, like, oh, this feels
totally
tight.
Yeah. If I would have gone back to the first day I started chiro school and would have felt someone's spine, I would have been, what the, like, I wouldn't know shit. I wouldn't know what I was actually putting my hands on. Maybe my hands are generally on the spine, but what exactly is it?
Okay.
Spinous process, transverse process. Am I on a facet? Like, when I adjust someone, I don't just go in there and just boom,
Right.
put a force in. I have to look at it from my own experience and my own just practicing the technique constantly every day. Because chiropractors, you have to train for this. This isn't like, you wake up and you already know how to...
You could kill somebody, right?
Yeah.
Technically, right?
Yeah, I mean, you can hurt people. You can really damage people. And it has gone to the point where it has become lethal. But those type of factors, those type of possibilities are like 1 in a million,
Okay.
Like you'll probably get hit by lightning before you actually, die from a chiropractic adjustment. But chiropractors go to school to literally learn how to not kill people. That's literally what they teach you, because you have to learn this to the T, and like you have to be careful. And they don't let you adjust until like probably last year.
Okay.
Last year going, and when you go into clinic, then you're allowed to see students. Then once you pass students, you're adjusting students, then you can start seeing people outside of school. So there's all these protocols and different things.
Well, and then you kind of touched on it as well, right? That it's not just like somebody goes in there and like, hey, crack my back.
Yeah.
It's not like that, right? You said it's there's a spiritual level to it,
Yeah.
and there's like your educational side
Yeah.
of it, right? Like what
Yeah.
you've learned, like
Exactly.
because when I first went in, I didn't know what they were gonna do. I just thought, oh, they're gonna crack my neck and crack my back. But you know, hearing you talk about it, it's a lot more complex than just going in there and
Yeah.
you're out.
Yeah.
Because even then, and I told you this story when one of the first, well, probably it wasn't the first time, but it was probably like the third or fourth time I was going to a chiropractor, and it was weird because I don't know, like I asked for a certain, like I thought, okay, my neck's kind of hurting.
Yeah.
I was like, is it possible? I thought, is it possible if I ask him? And I did. Could he? Because he had done it before. I was like, can you do that one where you pull my neck? And I don't know what what it's actually called, but then like I swear, man, I feel like he got gotten offended. He's like, oh, like, what? And then I had told you, and he also kind of mentioned that it's like one of those things where it's not always there.
Yeah. It's you don't really necessarily need it every time you come in.
So that's something I didn't even understand.
Yeah.
So can you explain a little bit more on what he meant by that? Like,
Yeah. So basically, when you walked in, you know, and I know you had a good experience probably because you're like, oh, can I get that adjustment again? And you felt really good after. And that type of chiropractic is you have to do a check first. You have to check because when you look for someone's misalignments, they're not generally the same misalignment. When you could do a correction, especially a specific correction, you start to notice the body change, and that's called the adjustment.
okay,
So that's
like
the
that.
adjustment is not the force. It's not generally what the treatment, what we do. It's how was the body changing afterwards, neurologically, biomechanically. Are we getting results as far as your goals? Am I getting results as far as my goals? Because from my chiropractic lens, I notice, you know, you have one side of your hip is higher than the other. So I want to correct that. I want to be able to make it level because you probably have lower back pain from it. As far as your neck, you know, you probably cranked it when you're in sleep. You know, 8 hours in bed. You had that fixed position. You wake up, you're like, God, you know, I have like this tension in my neck, and I really need to go see the chiropractor. So you get adjusted, and you come back, and you're like, I really want that same adjustment, but are the same problems occurring? Same.
I felt like it was similar.
Same symptoms.
Yeah,
Potentially. Yeah.
and he ended up doing it, but I feel like he got mad. I don't know.
I mean, every chiropractor, you know, they have their own reservations. You know, like they want the patient to, you know, you got to get checked first, and then you get adjusted. I think you probably had to address that situation before it was the time and place, but it happens. I mean, when people go in, they have no idea what chiropractic is about.
Right.
You know, and like I want to be educated. Like when I walked in, I want to know what chiropractic is about. Like not just getting adjusted. And I was that curious type of person, and I think that's what led me to be this way, to be a chiropractor, because I was so curious to the point where I was like, holy shit, why is this adjustment helping so much, not just with my neck pain, but I almost feel like I have a lot less fog in my brain. I can almost like hear better. Like my senses are almost like I feel like I've had a lack of sense.
Okay.
Maybe proprioception. I don't. My awareness in space wasn't the best, but when I got the adjustment, I was like noticing these things and becoming more aware of all these little things. And I was like, you know what? This is more to it than meets the eye. And looked up on YouTube like everyone else.
So
good old Google.
So for those people though that you know that the naysayers, right? The people that are, I don't really believe in it. Like, what do you tell those people? Like,
there's always going to be haters, man. In every single profession you are in, there's going to be your competitors, and there's going to be the people that got a bad adjustment, the people that their grandma got a bad adjustment. But we're all human. We all make mistakes, and you have to generally really listen to where is this person really coming from. And I don't really listen to people that don't have a valid reason as to why chiropractic shouldn't exist in their world.
Mm-hmm.
and those beliefs to me are very limited from my perspective because I have seen so much good from
Right.
chiropractic. You know what I mean? So I don't like to get in a, I guess, in a debate because I know with the experience alone, chiropractic has made me believe more and more and more and more and more to the point where it's a fact.
Okay.
Like with 100% certainty, like chiropractic has helped me, and I know it can help others. And if you don't want to be a part of that world, then you know I don't want to be associating my thoughts or anything or even trying to influence you in a way where I'm trying to get you to persuade you to think that chiropractic is the supreme being of, of
Right.
everything. Chiropractic is a solution, but it's not the solution for everyone.
Okay. And I could appreciate that because I follow this guy on Instagram, and one of my buddies follows him. It's about functional patterns, and functional patterns focuses on posture and biomechanics, and a lot of the things they do is challenging the way that we've done things forever, right? Like squatting, typical squatting things, showing how a lot of those exercises that we're doing, they do a lot more harm than they do good.
Yeah, exactly.
But when I talked to you about this, one of the things you said was, "Well, dude, I think you should use everything." Dude, I think that those would marry well together, including physical therapy, which is something that we talked about, right? That some chiropractors actually include some of these types of exercises and concepts into their own practice. I like that you're open-minded. I appreciate that. But why do you feel like it's important though to not ignore and to implement other therapies?
I think it's important that we try things, learn, listen, try to hear from other perspectives, other professionals. So functional patterns is a form of, like, for me, it's like patient education, teaching the patient, like, hey, what's your goal? My student, better improve my posture. So if I see a lot of people that have postural distortion, which I see pretty much on the daily, then I'm gonna want to get very curious about this functional pattern thing, because I'm like, if I incorporate this with chiropractic, it'll help maintain my adjustment, the adjustment I did on this person, to keep them in alignment. So if I can keep them in alignment longer than their general 1 week period, because of all the forces and all the stressors that they go through in life, repetitive trauma, your daily job, your daily duties, whatever you may be doing that's causing that misalignment, then I'm going to really highly recommend that you do functional patterns. As far as functional patterns and the mechanism behind it, it's still fairly new to me, so I'm not super knowledgeable about it, but I have some chiropractic friends that are they're really into it, and they're like me, they're curious. They're like, oh, what's this
But
about?
they're like combining both?
But they're combining both.
Okay.
So I think what the problem is these days, posture.
For sure, posture, bro. Especially with us being on our phones.
Yes, text neck, scholar neck, whatever you want to call it.
Shit,
That
I
is
love that.
really playing an impact. I've seen X-rays, people walking in 25, about my age, 22 to 25 years old. I take X-rays of them because we have to in clinic, and I look at their necks and I'm like, holy crap, the curve is not looking good at all. And
How's it supposed to look?
It's supposed to be a general lordosis, so it's supposed to be curved back like this. And with aging and with healthy deterioration of the spine, of healthy aging of the spine, as you age, that curve starts to decrease and becomes flat, and then starts to move forward. But now we're seeing people walk in with that curve reversed rapidly, at a very rapid rate. And I've noticed that with my experience in clinic, and I would go to my mentor, to sign off some stuff, and then she would have to look at the X-rays just to double check to see if there's nothing on there, any red flags or anything, and then she would notice the neck, or certain areas of the curves, and like, hey, I noticed, on her history that she didn't talk anything about any neck trauma. Has she had any neck trauma in the past, or him, or And I'm like, I try to get everything out of her, like she does. Has no neck problems, and she would be like, that's interesting because her neck looks almost like a 6-year-old neck.
Oh wow.
And I'm like,
What does that mean when she says something like that?
because For us,
how should a 6-year-old's neck should look, or how does it look?
6-year-old neck is like your discs are pretty much shaved down. Not shaved down to the point where they're completely gone, but I think 50 to 25%. Some certain areas where you have more pressure, like in the lower neck area.
How do you get that though?
So just aging and poor posture, trauma, car accidents, whiplash, stuff like that, high velocity accidents, and anything from getting hit on the head, anything can, falling off your bike, that can speed up that process, because that disc, it can cause a lesion in that disc, a herniated disc, and then it instantly increases the speed of deterioration of that level of spine, cervical, lumbar, thoracic, whatever it may be. And so you start to notice, like, okay, they have that curve because of that trauma.
Okay.
It makes sense. But when you start hearing patients talk about, I have neck pain, and they have no history of trauma, and you see them looking at their phone, almost bent over, looking down, you start to wonder, like, what's going on? Is it this? Is this poor posture that's going on, that's happening, that we're not getting educated about? Moving on from the industrial age into the information age, having these iPhones, having all this technology, we have to be mindful of what kind of damage it can also cause as well. And so just even sitting for long periods of time, we've already noticed that it can cause lower back pain and
sciatica, right?
Yeah,
right.
We've noticed that. I mean, it's been, for years and years since the started industrial age, we have desk jobs, we have cars, we move around, sit for long periods of times. And cases like this pop up on the regular, and we know exactly what to do. But the whole kind of neck thing, the text neck thing, we're starting to notice that this is not just trauma from one accident. This is repetitive trauma that's been going on.
So how do we combat something like that? Like for something for neck, just taking more breaks and stuff like that? Or
it's kind of like a dentist, how when they advise you to brush your teeth twice a day.
Okay.
Chiropractor wants to advise that you practice good posture, and a lot of it I would tailor it towards what you got, your goals and what problems, complaints you came in for. So if you have a neck problem going on, I would highly advise that you work on these postural exercises to keep that neck in alignment, which also helps to bring that curve. When you're in alignment, it helps to bring that curve also in its normal alignment as well.
So some of these things are reversible then?
Some of these things, depending on what your age level is, like when you're younger, you're moldable. Your developmental process can get influenced very easily through chiropractic. I've seen chiropractors change spines within younger children, preventing them from having scoliosis. And that's because their body's still growing and they're still kind of adapting to their final form, I would say, or their real form structure. And generally when things start to fuse, it's kind of hard to mold it the way you want it to. So I think up to 26 is when we have is the sacrum, is like the last bone that pretty much fuses. And from then on, I know that it makes it harder to make corrections and to keep it corrected. But there is essentially, through chiropractic care, there is essentially a way of keeping the patient mindful of their posture so you don't get more problems. You may have something going on, but would you rather have that problem stand still and be able to cater towards that, or would you rather have more problems, down the future, or if you didn't catch it on time, So there's things that we do to prevent you from even getting injured or having more problems like future disc lesions, because your neck has been, you've been on the desk job for 20 years, 30 years, and you're planning on retiring, but you have something going on here, like really, really bad pain that's traveling down, your fingertips and causing numbness in your thumbs and your...
You know what, dude? It's weird that you just said that. My dad has that.
Yeah.
Yeah, he started getting adjusted.
Oh, yeah. So we see people like that a lot, and by then it becomes even a harder problem for chiropractors. I mean, it's still manageable, but if I would recommend like if I were to really see a chiropractor, like if I would have known about a chiropractor, I would highly recommend you start going as soon as you start getting into sports or anything. As you get into school, like if you're in preschool, kids get seen from chiropractors. Some kids get seen as soon as they're born, as they're an infant. Like
Really?
Yeah, one day old and they're getting seen.
Why is that? Just because they're born with like certain, I guess.
I've seen digestion problems happen.
Birth defects was the word I was looking for.
Not necessarily, but I know like colic, like baby crying for long periods of times, and we're like, what's wrong? The baby can't explain to you what's going on, but I've seen chiropractors really take care of problems that the medical doctor couldn't. They're like, I don't know what's going on, but one adjustment, and you have more impact and more influence on that human being than you do someone being in their 50s.
Do you
60s.
feel like that has a lot to do with the touching sensation? Is something we talked about, that sometimes people when they go in, it's about like, since it's a deep, because like it's one of those things where for you it's not just like, oh, I learned this. No, you're always trying to learn, and you tell me you read books and stuff like that.
Yeah.
But it's like a very like like we talked about earlier, it's like a spiritual thing, right? So
yeah.
For some people though, you talked about traumas.
Mm-hmm.
When you talk about trauma, you're talking about the things that people have experienced in their life.
Exactly.
Right.
Yeah.
So one of the things that for some people, right, that touching feeling,
Mm-hmm.
It's important, right? Like it's one of those things where it's like, okay, you're touching it, but what you can feel, even though you don't know the person, you can tell like, oh, this person had trauma here.
Yeah, you can totally, after experience. I didn't say my first year in adjusting people or seeing people, I built that sensitivity, but as you go along and you see more spines and more spines, you're like, okay, you kind of already have a picture in your head as you feel the spine, and you kind of the person's history, but you kind of want to learn a little bit more, like, hey,
on a deeper level.
On a deeper level, because some people, once they go through a trauma, they could pretty much mask it, like not just the pain, but the whole memory itself.
Yeah, I've heard about that.
Yeah, and so when you adjust the person, they start to kind of retrace and relive some of the experiences that caused them to have this lower back pain or shoulder pain or neck pain, and it's one of those kind of, like, for me, like, it's a soft moment because I know that I had to get past the whole guarding, and really get past through their, not just conscious level, through their subconscious, because some people, some patients be guarding without even realizing they're guarding their muscle tissue, and in order for the adjustment to go well, the person needs to be at ease, they have to be at calm, pretty much, in order for them to be at ease. So we adjust them, and if we adjust them and there's muscle guarding, the adjustment might not go as well, and you might get some muscle soreness, some type of minor symptoms from it, but as long as you move the bone, then you make the biggest impact on their life, and stuff like from the most craziest moments I've seen when people just literally bawling on the floor, and like I thought I had hurt them.
Oh shit.
I was like, oh my god, like, what did I do? And it wasn't me, it was just the adjustment helped them, really helped them to figure out what was the source of the problem, and finally become one with it, and realize that they need to take care of it, and they need to
face it.
Exactly. They need to face it, and it could be not just a physical thing, it could be a psychological thing that they're going through.
Do you buy into those those straps that help with posture?
No, absolutely not.
Why is that? It's just shit's fake? Or
absolutely not. Okay, so braces are actually more destructive than they are good.
Really?
Braces are good for acute care. So if you just recently get injured, braces are good. Okay. We're pretty much replacing the ligament that's been damaged, or the tendon or the muscles that's not activating anymore.
Okay.
But if you see online, I'm pretty sure you get like a bunch of...
Oh, I get all those ads.
It's terrible what they're doing.
Well, it looks like it works, and sometimes, like, because I do notice sometimes I snap.
Yeah, essentially it looks good, like, oh, it's moving the shoulders back and it's keeping your spine upright. But
I've read though that's teaching your body like a bad, right? Like it's.
I mean, you're in that erect position, and that's the position you should you essentially need to be in, but you're not focusing on the muscle that's actually retracting you to keep you in the
Right. So
upright
yeah, that's what it was. That your
position.
muscle will become weaker, right?
Exactly. So
Yeah.
I would say braces are good if you get recently injured.
Okay.
Braces are not good for
Long-
lifestyle.
okay.
You know, long time use. Definitely would not recommend.
Oh, all right.
Yeah.
It is what it is, right? Like,
Mhm.
I wanted to know.
Yeah.
So you work from home. You travel from. You live in San Diego, correct?
Yeah. Currently, I
And-
live in San Diego.
And you come home and you treat people in San Diego, in down here.
Yeah.
And you, and before everything, you were treating people in Mexico, right?
So there was points in time
Uh-huh.
where we do mission trips,
Okay.
and we would see, like, we would do free service, free care for people in very low socioeconomic areas, like pretty much a lot of areas in Mexico. And there's one group, A Spine, that
Okay.
I had recently, when I was in school, I got in contact with, and I mean, it's in Mexicali, so
Ah,
I really wanted to do this mission trip. So I was like, these are the roots. This is where I'm, where everything started. So I really wanted to give back in that sort of sense. And I was like, yeah, like, sign me up. I'm ready. I don't care how much it is. Like, sign me up. I'm ready to go. So I did that mission trip during school, and I loved it. I love seeing people really genuinely happy, and knowing that they don't have much to give. They really, really gave a lot. That you can see how humbling that experience was.
what did you guys do? Did you just provide like adjustments and?
Yeah, we do our checks, and then we adjust. And
Okay.
there's doctors around that are mentoring us, helping us through, different
And you did
cases.
this all for like free?
All for free.
Wow.
All completely free. And it really helped me into clinic as well.
Okay.
Really gain that experience and that knowledge, and pick up on my Spanish,
Oh yeah.
because I know I wanted to be able to give back, not just to the audience here or the patient base here in the U.S., but also in Mexico. Like, there's not that many chiropractors out there, so
And that's one of the reasons why, bro, like, I think it's important to have people like you on this show to highlight that. Like, there's not a lot of Mexicans in a lot of things, not yet.
Yeah.
We're starting to get there, right?
Mhm.
You're starting to have more rappers, you're starting to have et cetera, right?
Yeah.
More athletes.
yeah.
So I mean, I think that's pretty badass. You also
Appreciate
traveled to India in 2018?
2018, going on to
How was that
2019.
experience, bro?
Oh man,
What'd
I
you
gotta
do
tell
over there,
you.
first of all? And why did you go over there?
So it's essentially the same thing.
Same thing, okay.
With every mission trip, you go and you give back to, and you give free chiropractic care to a low socioeconomic area. And this group though was more of a spiritual group.
Okay.
And the coolest thing about it was they were all congregating together in India, and so different people from different parts of the world from the spiritual group were coming together. And the spiritual group is called Nirankari. And oh my god, I learned so much from these people, like just from adjusting them and seeing. I didn't know their language, right? So I had
Okay.
an interpreter. Just seeing their reactions and just seeing their body language, I noticed how grateful they were and how appreciative they were of the adjustment and how well it worked for them in comparison to the adjustment working here. What strikes me the most, I mean, I'm still like pondering this till this day.
Okay.
What's most fascinating to me is understanding that the spiritual group has they're a group of faith. They're a group of belief, of hope, right? And one thing about this profession is you don't want to mix, science with religion, right? Because that's going to be like a little slap on the wrist. It's like, why would you do that? Like, that's moving the wrong direction. We need to have science, evidence-based proof, But the coolest thing is, from experience, just from being there, how humbling it was to understand that these people were getting more results than people here in America. And why is that? Why is it that we have miracles happen in India, but not here in the U.S.? And that really brought me to a different space, because I was like thinking about weird things, not a lot of things that people really think about, but it made me really question, like, is there a God? Is there this? Or, different. And I've already had that faith instilled in me, being growing up Catholic. And there is a time where I'm like, you know what? I've been in school so much. Science makes me believe that God is not real. I almost had that limiting belief. Like, we're, you know, we learn so much science. We learn so much of how things work, but we don't really know, like, why.
Mm-hmm.
And why is it that we're such an intelligent being? Why is it that we've been created with all these incredible systems like cardiovascular, respiratory, that work together to keep us alive, and we don't have to think about having them work together. It just happens. And that's what made me that's what not made me believe that. That's what made me feel for sure that there's an intelligence within us, and then there's an intelligence, a universal intelligence around us.
Okay,
And
I can agree with that. Because when I went through medical school, I remember, like you're studying anatomy and physiology, and like you said, our body is legit built to combat every disease. Everything that trauma.
Yeah.
Our bodies are designed to combat that and recover.
Exactly.
Obviously, they were designed that way. You can tell that they were designed that way. Obviously, it doesn't always work that way for certain people because of like the types of diseases that we're getting. But you can, like, every day, I remember even learning this in high school, and I don't know a lot about it anymore, but I remember learning in high school is that our bodies fight cancers every day. Like, there's different types of cancers that we're at threat for, and that's how you know your body's working, your immune system.
Absolutely.
And something that you always you tell me that's important for you is immune system, immune health, right?
Yeah.
Something that the population in this day and age, actually, I feel like we're starting to like really open our eyes to it, but it was something that we kind of ignored before,
Yeah.
What can you tell me about that? Like immune system health and how we should be incorporating more veggies, like
Well, for me, going through school, learning the immune system, not just learning the immune system, all the different systems that react with the immune system, and how the immune system has an influence on other systems as well. It makes me more certain that, we should trust in our body. We should trust in this intelligent design. And when we have thoughts, very limited beliefs, thinking that we're going to need, this medicine to help us, we're going to need that, we're going to attach ourselves to this physical almost mentality that we don't trust in our even our own body, we start to become more dependent. And we have this population in the US where we're just more dependent on on the authority, and we don't really know ourselves, and we lose track of who we are as a people too.
Or we don't assess ourselves, right? We don't check ourselves.
We don't check ourselves. And so the immune system is incredible because, one thing, we are right now encased with all types of viruses, all types of bacteria. But the thing is that you have to understand that there's a synergistic almost relationship that you have with viruses and other types of opportunists like bacteria, diseases, stuff like that. And you have pretty much more cells, more bacteria cells, more flora in your stomach, in your gut, than you do all the cells in your body.
I heard gut health is important, man.
Can you imagine that? And your gut health has a lot to do with your immune support as well. And not only your skin flora too, you have a synergistic environment here, working with your immune system, your cells, and the bacteria. And the immune system is trying to take out all the bad guys, make sure all the opportunists, all the bacteria that can essentially cause an infection are not, they're not, creating more quantity, more numbers to where it can actually really infect you.
For sure.
So my thing is, build your immune system. Create those checks and balances for your body. Make sure that you nourish yourself, and it goes along with three things. Your thoughts. Your mind is an incredible thing, and that's number one. What toxins are you putting in your body? So like food, for example, are you putting a food that's organic, or is it just, cereal?
Or processed.
Something that's processed, or Make sure that you're healthy to where, you're able to combat and prevent yourself from becoming injured. Traumas, different things that can cause you to get hurt. Can expose your skin, like being out in the sun for you need 15 minutes of sunlight in order to create vitamin D synthesis, in order for your immune system to build.
Okay.
But how much
is too much?
Is too much.
Right.
Then you'll start getting more the sunburn and your skin peeling, and now you're exposed to more bacteria because your skin's not able. You took down that barrier, so now your immune system's not able to combat all these different invaders. So knowing what is too much and knowing what you can prevent yourself from getting into, just being mindful and knowing and becoming educated on these things. And I want to be one of the beacons to that, and one of the people that you can come to.
So what led you personally to seek better health? What led you on this journey of chiropractic?
So I've always wanted to get into like healthcare, helping other people. That was like my why, helping other people, right? But as I grew older, made a lot of mistakes.
Yeah, I mean, because you were, if I remember correctly, you were thinking about the military, correct?
Yeah. So the military was my first option, and I'm kind of happy that actually I'm 100% happy that I didn't get into the Navy. Shout out to my recruiter. And it really opened up my eyes because I knew there was a different purpose. There's a different plan for my life, and I'm glad I'm here today sitting with you talking about this because I want to be able to give back to my people.
I love that, bro. I love that. For real.
Appreciate that.
La raza, dude.
Yeah, dude. Like, we have been unnourished. We've not just with food, with different, we've been uneducated on different matters of health. And
oh, you're right, man.
It doesn't help that our culture has one of the best cuisines.
Amen. And it doesn't help, dude, that
a
lot of people are stuck in like traditions,
Yeah.
in our culture. It's like, oh no, don't do that.
Yeah.
We don't do that.
And it's like, why?
Or why do we do this?
If you challenge it, then, you're going to get a sopapo to the head.
For real, dude. For real. A chancla, dude.
Yeah, or a chancla, exactly. So I'm the type of person, I was very rebellious growing up, and I think that's one of my biggest gifts because I challenge it. I challenge, the authority. I challenge what is it? Why is it that we're doing this? Why? And so I am here today, and I want to be able to kind of change the culture.
Hell yeah.
Not just with the Mexican American population, but with other populations that know that food is good, but we also have to have a great relationship with food because it can really take over our lives and cause a lot of pain.
You're talking to the guy that, fuck, man, that's my weakness, bro. Food, for reals. I think that's the one I suffer with the most as far as discipline goes, man.
And it doesn't help that you grew up eating one of the, growing up with good food.
That's what
right?
Carlos says all the time.
And food brings us together. So it's how can we make food good but healthy?
Yeah.
You know what I mean?
Well, balance,
Exactly.
Balancing it out.
Exactly. Balance.
Yeah, man. You also provide cupping therapy, correct?
Correct.
And something that I definitely am a fan of. The first time I did it was probably a year ago. I combined it with acupuncture. What is cupping through a chiropractic lens, and then why do you feel like it's helpful?
So chiropractic has nothing to do with cupping.
Okay,
but
I'm sorry. No.
From a chiropractic lens.
Okay, there we go.
My thing is understanding the interference within the body and knowing what is it that caused this person to essentially not be able to adapt to their environment or to their stressors, whatever it may be. And it could be anything from a toxin, like we just talked about, with the foods they eat. They just got into trauma.
Okay.
What can we do to help get them better? And is it something psychological? Are you really experiencing that much pain?
Okay.
Or are you masking something that's a serious problem? You know, and you say you don't feel pain, but this is something that can really, really cause more damage in the future.
Okay.
So I look at it from that, and I look at it from what's the interference? What's causing that disconnect between the brain and that body? And I start to understand, like, okay, through my chiropractic lens, I'm going to adjust whatever joint, whatever displaced bone that they have. And typically it's the spine, and we get a lot of great results from that. So we start with the spine, and essentially the brain and body communication, the flow of it is better. It's improved.
Mm-hmm.
It doesn't necessarily have to be 100%, but we want to shoot for 100%. The flow, which meaning the connection between the brain and body and the communication going back and forth.
Mm-hmm.
From a cupping perspective, sometimes, and what I've learned from experience, because I was, I'm a curious person. I like to use different holistic ways of taking care of people without being so invasive. I started to use cupping, and it's been used for ancient,
Yes, in China, right?
Yeah, like ancient times. And I'm like, this has helped so many people, but why is it not mainstream? Why is it not something that we practice in the Western world? It's an Eastern practice. So my thing was, let's incorporate chiropractic. Chiropractic was actually, it started in the U.S. So I was like, let me incorporate something like natural, that's Western developed chiropractic, incorporate something Eastern, and we'll see how those two combined make a difference in this person. And sure enough, like from just using my chiropractic lens alone, I noticed that really, like using the cups on people's spine, and generally what the cups do is they pretty much, it's a pressure within that cup wherever you place it. It's a reverse pressure, and it pulls all the toxins, everything that was essentially blocking or interfering with all the important stuff like the nerves, things that were functional at 100%, but were not as at 100% because of what was attached to it. Could be heavy metals, and I'm pulling those to the surface of the skin, so that way the blood circulation can do away with it. It travels either through the lymphatics or the blood.
Okay.
And lymphatics drops it off in the blood circulation, and eventually you excrete it, and you do away with it. And what I do, because of the joint, through a chiropractic lens, I know that there's not that much blood flow in the joint. I want to be able to pull enough blood in that area, because it has been lacking. Blood helps to remove a lot of toxins, right? It helps you recover faster, helps you heal faster. If there's no blood in that joint, then how is it going to essentially heal? So what I was doing is placing the cuppings over the spine to pull all that blood in that area where it's lacking, speed up that process of recovery, and remove all those toxins so that the person can be more at ease, essentially.
I like that. And can you define holistic through a chiropractic lens?
Being holistic,
Because that's what chiropractic is considered, correct?
yeah,
Like a holistic.
it's a holistic mindset for
Okay.
sure. And we go through philosophy, the books, the green books we call them, and they're invented by, not D.D. Palmer was the creator, but the innovator was B.J. Palmer.
Mhm.
And man, he
That was his son, correct?
That's his son, yeah. And that guy traveled all over the world, and specifically in areas in like India and Asia and stuff like that. And he picked up a lot of stuff. He gained a lot of knowledge, and part of it was the whole holism, understanding the body is from a whole perspective. And I think a lot of other professionals are starting to notice that as well. You can't just be a heart specialist. You can't just be a lung specialist. You can't just be, a liver specialist. You have to literally know what influences, all the systems influence that organ that you're specialized in. From anything from the brain to the immune system to the heart, those are all different systems you're tapping into. And so when you look at it from that standpoint, you're talking about being holistic.
Okay.
You're generally incorporating all these systems, and you're applying it as one full like full body, one full machine.
Mm-hmm.
And when I look at that holistic mindset, when I look at your spine, when I look at all your distortions, your history, and everything that plays into impact with what your complaint may be, I look at it from the whole body, not just, well, what if your neck problem is because of your misalignment in your pelvis, or vice versa? What if you have a pelvis problem, and you have a lower back pain, but it's being caused from your neck?
Mm.
And it's like, how I like to picture it is like when you play like Jenga,
Okay.
that game. So one little block and the whole thing tumbles.
Yeah.
Right? When you, as a chiropractor, we're putting all the blocks together and strengthening that foundation so it's strong, and so that there's complete connection, communication from the brain to the body. So that's how I see the spine.
Mm-hmm.
So if there's missing blocks here, there's going to be another part to your body that has to sacrifice its tissue in order to compensate for the lack of something that's going on. So if you have an imbalance in your neck, like let's say you get injured, and let's say actually you woke up and this morning your neck was cranked, right? And you're like looking to the left because you have a lot of, you can't look to center because
Mm-hmm.
your neck's in pain.
That shit happens to me every once in a while. For
Right?
sure. For sure.
It happens to all of us, man. We have our days, but that's going to create a whole body change. And what the brain wants to do, it essentially wants to put it wants to be at level with the horizon. Your eyes want to be at level with the horizon. So neurologically, if you have your neck's pointing to the left and you want to look at someone like straight ahead, you're going to have these weird,
Yeah.
exactly. You're going to
like,
accommodate, accordingly. And you're not going to realize it consciously, but subconsciously you're going to be doing it. And eventually it's going to, if you have that neck trauma for a while and you've had that pain for a while, it's going to cause more problems down the road. But that's just an example. I've seen people with traumas like car accidents that have whiplash. And like, it's all, a cascade of events, neck problem, all the way going down, or vice versa.
You mentioned something to me when I was getting adjusted to you, by you, the pillars of health. Can you re-educate me on that?
Yeah. So
And how it.
there's this paradigm that I just really want to.
Okay.
I really want people to understand, and this is the new kind of healthcare system that I'm starting to see within my generation, being a millennial and all. I want people to be able to stay healthy, because it's harder to treat someone that's sick than it is to keep someone healthy.
Okay.
So let that settle. It's harder to treat someone that's sick than to keep someone that's healthy.
Okay.
And so the pillars of health, essentially, it keeps you healthy. It not only keeps you healthy, now we can look at it from a wellness standpoint. Like, we want to be able to thrive, right? We want to be able to become better than we were yesterday, right? So what can we do? Not just keep ourselves healthy, but what can we do to ever prevent us from getting sick? Ever prevent us from getting injured? Ever prevent us from, whatever that occurs in the world as a stressor that causes us to, as a populace to suffer, And so we have nutrition. That's a pillar. That's a strong pillar. We already know.
How many are there? There's a bunch, or
There's 4.
Oh, okay, 4.
There's 4.
I just want to make sure.
There's 4. And one of the pillars is chiropractic.
You said nutrition as well.
Nutrition, chiropractic,
Okay.
and motion.
Motion.
Being active. And notice I say motion because not everyone talks about, fitness, weightlifting, all that. And not everyone really has a good experience from it. And they like yoga. They like functional patterns. You know what I mean? So that's why I don't ever cookie cut the pillars. Like, some people that have like a keto diet can have better results than someone that someone that's in a keto diet that can get sick from it, you know?
Yeah, I've heard about that.
It's all kind of like knowing exactly what is fit for you and strengthening that pillar.
Tailoring it to your specific
Exactly. And then,
person.
Exactly. And then motion, nutrition, and the mind. The mind is I think that's, if I were to pick in the hierarchy of pillars, if there was a hierarchy, I would say the mind. The mind, you need to train that every day. And some people don't even know how to train it. As growing up, I didn't even know that, I didn't know about meditation. I didn't know about affirmations. I didn't know anything.
I used to, it's funny because I used to talk shit about affirmations. But I see the merit. Like, I see, like, sometimes you need that little, like, that somebody
motivation, maybe, or just reassuring yourself that.
Reassuring, I think that's
reassurance, yeah. But I started to notice growing up, like, you know what? I have a lot of limiting beliefs, because I've learned to just be okay with someone telling me, like, I'm not good enough, or I'm not athletic enough, or I'm not big enough, or I'm not. And I knew that if I challenged my mind to go through those different stressors, and tell myself I can do this, then I can achieve, a lot of great things, more than what I expected. And I've noticed that just being in school, I actually read, it was crazy. I was reading my journal like a week ago, and it talked about, and I had an affirmation saying that I'm going to pass my boards. I'm going to become a licensed doctor. And it was right before, I remember the feeling. I was like, you know what? These boards are going to be fucking hard. Like, they're going to be tough. Yeah. And why is it that I'm wasting time with these affirmations? It's like, I should just put in the work. Put in the work. And that's how, like, most of us we're taught, like, just put in the work, hard work. But it's also...
I'm a big believer in that.
Yeah, and it's also, like, put your mind into it. Putting your mind and the hard work that comes behind it. Putting the thought and then the action. And so I never used to put the thought. I was just go ahead, let's do it. I already know what the goal is, but the thought, there's so many things to the thought itself. You have to reaffirm to yourself, like, I'm gonna do this. And when anyone does tell you you're not good enough or whatever it may be, you already have that affirmation, that strong belief within yourself, that is going to literally push that thought away. And I've noticed that within my mind, practicing meditation, practicing affirmations, it has really helped me through school, and it's helping me a lot today. So the mind, incredible. Practice it every single day, more than I would say practice physical fitness and nutrition. Fourth thing, chiropractic care. In my paradigm of what the 4 levels of health should be, is seeing a chiropractor. Because chiropractors, not only do they adjust you and they treat you, but they, like, educate you.
For sure.
And when do you ever walk into, your primary care physician, and he's literally teaching you about your health, versus, like, this is what's going on with you, and this is what kind of medication we're going to be prescribing you, and then done. You have any questions? Versus, like, a chiropractor is really essentially
No, you're good.
This is essentially,
it's like a guide, right? Like, hey, I'm going to show you, I'm going to explain to you, so you understand it.
Exactly. And I want to be able to do that, not just educating people, because I know a lot of people, they hear the recommendations from their doc and they don't really take it serious, but I also want to be an example, and I want to be able to be that paradigm in this generation where if you're a doctor, you have to put in the work to become what you say you are, what you say you should,
what you're trying to do, right?
What you're trying to do.
Help people.
Exactly. And if you're telling someone to eat healthy and you look like you haven't, moved out of your seat in like 2 days, then there's a problem. And would people really believe someone? Like, would people really, like, take seriousness someone's recommendation if they don't look the part, or they don't
act the part,
speak
as well? The part?
Exactly. So
which is something, bro, that I've told you numerous times already, but it's something like hearing you talk, dude, growing up with you. I remember how you were, bro. Me and Carlos remember you, bro.
Oh man.
I mean, I've known you since you were, what, 15, maybe 16?
Yeah. Since we were youngins.
Yeah, dude, and we wrestled, and you and James were the biggest clowns on the team, bro. But it's really impressive, dude, to hear you speak right now, and even off the camera, you speak the same way. You could really tell that you've grown up, obviously, but you could also tell you've matured, and dude, you sound like a fucking professional to me.
Thank you.
And it's something, dude, I think that, you definitely need some recognition for. We kind of talked about
that.
really quick about...
it was a long journey, by the way.
It always is, bro.
To get to that, it was a lot of mistakes. A lot of people were just telling you, like, hey, like, grow up, And to me, I played a space and time. My thing was live my life in chapters. If I'm going to be in high school, like... I know I'm going to be ignorant. I know that, I'm never going to experience this again. So make all the mistakes you possibly can, because I'm the biggest believer in learning from your mistakes. So
me too, man. A lot of people, they think, oh, this is great, you started this podcast. But dude, I made a lot of mistakes when I first tried to start the podcast. Like you said, I didn't really put in a lot of work into it in the beginning. I just thought, oh, if I do it, or if I get this equipment, it'll happen.
Yeah.
And it didn't happen like that.
Yeah, it doesn't work like that.
But we talked about meditation, right? And you think that's really important. Why do you think that's
super important? I think in today's world, I've just noticed, like, being on social media.
Yeah, because we're all connected
We're all super connected, but we have to understand that, like, there are some situations happening in this world that we have no control of.
Okay.
And so that builds anxiety within us. We're like, oh my God, like, why are these people getting murdered in front of us on camera? Like, why are the political systems, forcing us to, like, being, oppressed people? Like, I know we are a minority, but how is this affecting, eventually it's going to affect my life, and I'm going to be stuck in a situation where, I'm going to be that minority, that gets put in a situation where it's almost as if, someone is out to get me. So the majority is trying to attack me. And you see that all over social media, like what's happening now with just coronavirus, and not only that with Black Lives Matter. But we need to hear these people out. But we also need to understand that the best way to make a change is to make it within yourself. And that's why I am such a big, like, endorser and advocate for meditation, because it has literally saved my life. I don't really feel anxiety as much when I go on social media, because essentially when you're on Twitter, you hear a lot of people's problems, and
yeah, people like to post their shit.
Yeah, and then Instagram has their photos and whatnot, but you start to notice the psychology behind that, and you're like, I start to feel almost as if, like, people are trying to compete with each other, and people are there's these, like, traits within a person that start to become more amplified. Jealousy, greed, like all these things that are not healthy to even hold, like, within yourself. So when you meditate, it actually makes you a good person. And it makes you a good person from within, and then out you express. And when you talk to people, when you're around people, you essentially make them a better person as well. And I noticed that the Dalai Lama practices a lot. And they're...
so when you say meditate, you're literally, like, in, like,
it's the easiest thing to do. And literally, yeah, you can be seated right here, like what I'm doing right now, and you can just practice it. You can even have your eyes open. People run and meditate. There's different ways of doing it. I'm
just trying to get, like, an understanding. When you say meditate, what's the goal there? It's just to relax yourself?
You're essentially, the goal is...
Because it's impossible to, like, stop thinking about everything, right? It's impossible.
Now, I used to think that too.
Okay. Oh, educate me then.
But when you start to practice this meditation, you can really like from you know that you've become more experienced and you practice this so much because there's been some times when when I first started, I was like, all right, let me try 5 minutes. All right, let's see what 5 minutes does. And then I wake up and I'm like, okay, this is a waste of time. Like
Okay.
I could be studying right now. What am I doing? You know? And then I was like, you know what? My curious side was like, you know what? Let's try this again. And 5 minutes in, 10 minutes in, 20 minutes, 30 minutes, an hour in the sauna.
Okay.
Like different things, different environments also.
But you're just trying not to think about things. Is that the goal?
You're
or-
just trying to focus on your breathing pretty much.
Okay, there we go. That's
Yeah.
what I wanted to hear.
But what that does, ideally, it helps you not think about stuff.
Yeah,
either.
that makes sense.
So when you go into that phase when you're in that meditative state, it takes a while to practice that and become,
Good at it.
Good at it.
Yeah.
And I can see how the Dalai Lama, like, they practice that so much, and they can go days without eating because they have so much control within themselves now. They become literally a master of themselves, and so that's what I want to do. That's if I can control my thoughts and not let my thoughts control me, then my outlook on life is going to be so much better. My quality of life is going to be so much better. And once I learned that simple trick, I just started doing it more and more. And now I see it as more of like a lifestyle. Like I have to do this. Like, so I incorporate it with my daily routine.
Okay.
At least 5 minutes. At least.
Okay. And I know that okay, so we kind of said it earlier too. Just want to go over it one more time. It's not a solution for everybody, chiropractic.
Yeah.
But specifically, are there any people, like groups of populations of people that should not get adjusted? Is there?
The thing is with chiropractic, because there's so many techniques.
Okay.
There are like some techniques that like are more suitable for certain patients than others. The whole kind of
pregnant women can get adjusted, correct?
yeah, pregnant women can get adjusted, and we have the Thompson technique, and it was essentially created by another chiropractor that was going through school, and then he wanted to help people, right? But specifically, maybe people in the geriatrics field, pregnant women, because pregnant women have a lot of pelvic problems too.
Oh yeah.
Before giving
Sure.
birth, and so applying that technique where you pretty much use gravity to your advantage, and it's less of a high velocity but more of an impact, and you get more results with that certain patient. And that is why that technique was essentially created. But it helps everyone. And the whole manual adjusting, some people even use like tools to adjust. Some
Okay.
people just adjust one bone, and it's the upper cervical. We call it upper cervical technique. And there's different techniques within that as well. And I find that you can help people with different neurological stuff when you do upper cervical versus you doing manual diversified adjusting, pretty much. That's what, in the umbrella of it all, when you see a chiropractor, you're typically going to get a diversified adjustment. When you start noticing more specificity, you start to get techniques like Gonstead, upper cervical, and don't get me wrong, like, all of this is already done specifically to its approach, the way the chiropractor sees it. But they use different diagnostic tools like thermography, like we even use x-rays to look at misalignments. We even check HRV. We've been doing that as well.
What's HRV?
Heart rate variability.
Oh, okay, yeah. I've seen
Yeah,
that. I know a lot of
so-
fighters are doing that stuff now.
Yeah, and that has been a tool used by the medical profession, and we have been because some of our studies, a lot of medical professionals don't see it as legit, because like, all right, well, how are you going to see the results?
Mm-hmm.
All right, well, we're going to adjust someone, and then the experience that they get behind it, whether they find less pain, you had a pain 6 out of 10, now you have a pain level 4 out of 10. We saw results, great. medical professionals, they don't really like see that as like to the gold standard. They
Okay.
want something that shows quantity,
Okay.
shows variables, HRV. So we essentially used the HRV and took it as our own. We started implementing it into pre and post adjusting. And oh my god, like in the clinic, there's so many results that you get from that alone.
That's interesting, bro.
And so when you see medical professionals kind of really like, they want to talk, say chiropractic isn't real, it's like a belief system. It's not, it's not
Well, even if it was though,
it's
dude,
yeah.
it works for some people. It really works for some people.
So
I believe. Go ahead.
Exactly, it works for some people, and we use our studies that use HRV that tell them otherwise.
Okay.
This is your guys' diagnostic tool, not ours.
Yeah.
So why is it that we're getting results from pre to post adjustment? So essentially, what I've noticed is seeing great results within the nervous system through HRV, because we like to tap into the nervous system when we're adjusting people, and that's why we use it. But medical professionals are starting to really take our profession more
seriously.
more serious, because we're starting to use their diagnostic tools.
And I read that too, as when I was doing my research. I read that over the last couple of years, chiropractic has gained legitimacy. It's gained acceptance, especially here in the U.S.
Mm-hmm.
We're getting close to the end here. I just want to ask a couple more questions.
For sure.
Are you a straight or are you a mixer? And for those that don't know, he's about to explain what that means.
Man. Okay, all right.
We'll end on that question, and then the last few things about your giveaways and stuff.
So, a straight is a doctor that practices straight chiropractic. Like, that's it. We're doing just chiropractic today. A mixer pretty much incorporates, maybe physical therapy.
I saw ice therapy. Correct?
Yeah, crowd therapy. Anything that's a therapy that they can implement, that they can do for the patient, that is considered mixing. My whole viewpoint on that, though, being the new generation that it is, that we're in, there's been a constant battle between straight mixers. Like, we've been bashing at each other like for so long.
But you said you don't even identify as either, right?
I'm neutral.
Okay.
As far as right now, because I used to think like a straight, and now I'm thinking like a mixer, and then I'm thinking about the patient, and then I'm thinking about, myself and how I want to see myself, because I wanted to be a nurse from the beginning.
Okay.
And it's like, what made me change my mind from there? And it's like, I'm a chiropractor, but my whole thing is like, I want to help, our population. I want to help my people, and like, if I can help them with chiropractic alone, perfect, great. But if I can help them in a natural, non-invasive way, even better. So I'm kind of opening the horizons, widening the horizons with that. And my thing is now is I don't want to confuse people to think that cupping is chiropractic, because it is absolutely not chiropractic. I want people to understand what is chiropractic and what is all these other therapies I'm incorporating. So when I actually see a patient, I don't do everything under the sun, like everything that I have in my toolbox. I do chiropractic, and that's it. When they come back the second time, then we see, okay, is this something that I can maybe use cupping for? Because that's on the second, subset to the whole umbrella. Or, should I use maybe cold laser, and or maybe should I educate them on better postural exercises, or should I? And even chiropractors that are straights can even say that's mixing too,
I get it. Okay.
And it's like, a lot of straights have so much. They have so much like belief and certainty like into the chiropractic adjustment that some would risk, someone getting medical. Like, I've seen someone, when they did this with their child, they have so much belief in the chiropractic adjustment that they didn't give them the proper medical care that they needed, but turns out that they got better after checking them every single day. And this is not adjusting. This is checking them. And if they're still within what we call at ease, and they're able to, they take in the adjustment and they're able to be within that. They don't need an adjustment. Essentially, they will hold off, keep holding off, but they're gonna keep checking and checking and checking until finally they need it and they adjust. So straights, they're down to that, like literally, they check, but if you don't need it, you're not gonna, the body doesn't need the force, then you're not gonna need it. So straights, they're by the book when it comes to that.
All right. Do you have any role models? I know that on your Instagram, back when in 2019 when Nipsey Hussle died,
Yeah.
rest in peace to a legend.
R.I.P.
Even though I'm not like I'm not necessarily a fan, I just don't necessarily listen to him. But I know he is respected by a lot of people. I know he's one of your role models. Are there any other role models you have?
So, like for me, growing up, literally starting from the bottom, I think knowing to make a better life for myself and making, and not only making a better life, but becoming a leader in that perspective and changing not just your own life, but changing others and turning around and kind of leading, being the person to, take responsibility, not just for what you do, but for the people around you, and putting others before you, and wanting to see your future not just bright but other people's, right? I think Nipsey Hussle, he knew he had it down. He knew he had the plan, and he did everything.
I know he helped a lot of people.
He helped a lot,
especially
of people.
Within his own community. Correct?
Yeah, and the thing is, it just goes with this. It's as long as you're getting, you're receiving. You have to give back. Like, it goes
pay it forward.
Exactly. You have to give back to your community. You're receiving all of this, education from day one since you started school. We have it so well here in the U.S. that like we don't appreciate like being able to read a book, being able to be knowledgeable about stuff, being able to change your life by, leaving the valley. Leaving the valley to where you're around, I was in the Bay Area, so it was a huge melting pot. Learning from different like cultures and groups, and understanding like, hey, like
understanding that we come from like a very
enclosed conserved space, like
and you go somewhere else and it's just
the way
like,
of life is totally different.
I had this conversation with a girl too. She said that she realized when she joined the military that she realized, because it was a topic about how obviously the podcast is like focused on people, Mexican Americans, people of color, Latinx, Hispanics, whatever.
Yeah.
But it and I told her it's cool that that you're like that, because I remember her in high school, and it wasn't that she wasn't necessarily like that, but our generation, now I'm starting to see them embrace our culture more, and it's something that from when I was a kid, it's something my dad had always told me: be proud to be a Mexican, or Mexican American. And be proud. Be proud to be American, but don't forget about your Hispanic roots.
Exactly.
And that's something that we were talking about. She said, I realized when I joined the military that she really started to appreciate her Chicana culture.
Yeah.
Because people literally will look at you and be like, oh, you're the Mexican.
Yeah.
And
I get that. I had that a lot, so much going to school, and it was during the Trump era when he was trying to run for president, and people, you'll find when you leave the valley, it can get more racist, it can get more prejudice, it can get very, very tough. You have to have a really strong heart to overcome this stuff.
I think we're lucky. A lot of us down here are lucky. Not everybody, but a lot of us here are very lucky that we've never truly experienced true racism. But there are some people down here that have experienced that.
Yeah. And we don't want to let those be forgotten, but we want to start somewhere, and eventually when you leave the valley, you want to be able to learn from the environment, learn from the people, and I'm blessed enough to be in the Bay Area where it was like a melting pot, huge cultures everywhere. I was rooming with people with different religions, different, you
Right.
know, ethnicities.
So you were
and-
growing.
Yeah, and I noticed, you know, they have their reservations. I have mine. I can't have my comal on the oven.
Mhm.
You know, I can't always have that on there, but I have to respect people. You know,
You can't put all the dishes or the trastes inside,
inside
the
the
oven.
oven, exactly. You can't be doing that no more. And I didn't see it as a sign of kind of like disrespect or being, not taking responsibility for, your dishes or whatever. But I respected people's religions too. Like if you're gonna practice, a certain thing, be proud of it. Be true to it. And my thing was educating people like, hey, traditionally, like, we do this. But if it really, really bugs you, like,
I'll stop.
I'll stop.
Yeah.
Yeah. It's no biggie,
That's really interesting, dude.
Yeah, man. So I had to go through those little milestones, and people just kind of that are coming from, I don't know, just in the U.S. alone, like Midwest, East Coast, wherever, people just yelling out, their little racial slurs and remarks, and build that wall in front of my face,
Yeah.
That to me was a little disheartening, but to me, I felt like being the bigger person was to kind of.
Well, that shit had to make you stronger, bro.
It did, and it made me a better doctor because I start to feel like I need to care for more of these people because they're misconstrued.
Hmm.
They're being led the wrong way.
Yeah, they're misguided.
They're misguided, exactly.
For sure. All right, bro. So this is pretty much the end of the episode. I want to really thank you for, coming on. It didn't come out with a few problems, that's for sure. But we ended up finishing pretty strong here.
I'm glad, dude. This came out really well.
Hell yeah, dude.
For the technicalities we had, but
hey, that's all. That's the part of the process.
Exactly.
I want to touch on two quick little things at the end. You say you do some giveaways. You just did one recently.
Yes. So I did
Go
a
ahead.
giveaway, a $50 giveaway for my brother's company, Romero Barbecue.
Okay.
And I do that just to practice generosity and just giving back to people. And I do that also on my Snapchat. If you want to follow me, it's a Lion Spine. Also on my Instagram, Lion Spine.
And then you're on Facebook as well, correct?
Facebook, yeah.
But you're under Christian Romero, just as.
You can find my page, Dr. Christian Romero.
Oh, okay. I'm
if
sorry.
you like. And you can also add me on Facebook.
Okay.
It's Christian Romero. I don't think I've added the doctor yet. It's still.
I don't think you have because I looked it up. And,
Yeah.
But it had a lot of your information.
Okay.
Yeah.
I gotta change that. It still doesn't feel real to me.
So that's the best way we can reach you, right? Social media and stuff.
Social media is the best way to reach me, and like I said, I do giveaways. I started on Snapchat first, but I'm gonna start doing Instagram more, and then just build up to it. And basically, what I give away is I do gift cards like Nike, Adidas, as far as like the whole kind of, and it has to do with kind of like the 4 pillars of health that I was talking about, right? As far as nutrition, I give away gift cards based upon the grocery store, how much organic food they give, like Whole Foods, like Sprouts, areas within my neighborhood that have grocery stores that give away like that sell organic based products, and I just want to give away these gift cards so I can get more people acquainted with trying out the good stuff.
Yeah, trying to be healthier.
Like one meal will change your life. Like shopping at Sprouts, shopping at these Whole Food stores, like it really changed my perspective on health too. And doing the whole giving away Nike and Adidas, like just kind of promoting the whole being active as well. So I've been doing that, and I've also been doing kind of like just like greet meets. Basically, you just I do a giveaway where like you can meet a chiropractor and we can talk about your health, and if you want to get adjusted, like cool, we'll get you adjusted too. So I've been doing that too.
What are you okay with talking about how much you charge or anything like that, or or would you rather just meet the person and then you could talk about prices then?
Yeah, I'd rather just do that. Yeah.
I'm just gonna say it's actually extremely reasonable prices.
Yeah.
At least right now, right? At least while you're establishing
Yeah.
yourself.
Yeah.
Even then, though, as far as I know, the most expensive I paid to get adjusted is like $50, and I don't even think that's that bad. Considering you'll spend $50 on some other stupid shit, why not spend it on your health, right?
Exactly. And that's the whole mindset that people, when you go to the gym, you pay like maybe $50, so like around $20 monthly.
Yeah.
If you come see me, you're getting more of that value. You know what I mean?
For sure.
And it's the value that I kind of want to just express to people. Like, you're seeing a doctor, not only someone that lives and breathes health, but he's treating you too.
Yeah.
And he's teaching you how to.
I feel like numbers
Right.
can be misleading anyways.
Yeah. So in terms of that, my numbers are so different right now. Like, as I just had my office in San Diego, I just added that. So I have different numbers.
And it makes
Right.
sense, right? For
Yeah.
different populations.
Exactly.
Yeah.
So my way of making it affordable for people was based off my location.
And that's cool, man. I can appreciate that. All right, bro. Again, I really want to thank you. Seriously, this has been awesome. Hopefully, maybe I can get you again in the future.
Totally, man.
Maybe get your brother on here too.
Yeah, I'll talk to him.
But either way, though, I'm very happy with the information that you told the viewers, the listeners. Again, this is Dr. Christian Romero. If you want to get adjusted, I highly suggest that you reach out to him. I recommend it. Even if you've never done it, I think you should try it. It doesn't hurt anything to try it. But again, thanks, man.
Thank you, man. I really appreciate you having me on here, and for just starting out as a chiropractor. I really didn't see myself what my story really kind of looked like, because I haven't had time to reflect. But with this whole coronavirus thing, everyone's taking a step back and really seeing like what they've already gone through, and hopefully I can inspire someone eventually become a chiropractor, look into chiropractic, or even receive chiropractic care. So
yeah, and if anybody has any questions as far as what school he went to, go ahead and reach out. We did mention it on the podcast already, but again, he has got all the information.
Mm-hmm.
Thanks, man.
Thank you.
This has been In Regards to Myself. I'm your host, Jesus. Thank you for watching. Thank you for listening. We'll see you next time.